Hello, my name is Dr. Amanda Condon and I am a member of the Transplant Pharmacy team. Thank you for taking time to watch this educational DVD today. We would like to give you information about your medications so that you can have a successful transplant. Our talk today will go along with your handout, and so please follow along and write down questions as we go. At the end of this video, a pharmacist will be able to answer all of your questions. With that said, today we are going to review three key sections. Section 1, Taking Your Medications, Section 2, Tools and Resources, and Section 3, Transplant Medications and Supplements. So let's start with Section 1, Taking Your Medications, and we will start with how important it is to follow instructions. You need to take your medications exactly as they are prescribed by your healthcare provider. This is called adherence. When you are ready to go home from the hospital, we're going to give you a medication discharge sheet. This discharge sheet will list all of your medications you will be taking at home. It will include the drug name, the number of tablets or capsules you will take, and what time of day you will take them. We write the times that your medications should be taken to avoid drug-drug interactions and to limit side effects. It is very important that you follow this discharge list exactly as written because these medications are keeping your new organ working for you, and they are preventing you from getting sick. Missing doses, taking the wrong dose, taking medications at the wrong time, and taking medications that are not on your discharge sheet can possibly lead to failure of your new organ and serious health complications. So, you might ask, Amanda, if taking medications is so important, why would anyone take their medications incorrectly? Well, here are some examples of why some people struggle with medication adherence. 1. Confusion. After receiving a new organ, you are started on many new medications all at once, and it can be confusing to keep everything straight. That's why we're in class today. When you leave today, we want you to have a solid understanding of your medications. 2. Unable to pay. We have pharmacy technicians that check the cost of your medications. Before you leave the hospital, the technician will talk about the cost with you. 3. Lack of supply. The medications that you are receiving for your transplant are specialized. They likely will not be stocked at your local pharmacy. Because of this, you should call your local pharmacy at least 1 week before you run out of medication so they can order it. This way, the medication will be stocked when you need to pick it up. We will fill your first month of your new prescription here at the hospital so you can take them home with you when you leave. If you'd like to stay with UW Pharmacy, that's great. We'd love to have you. But if you want to fill it at your home pharmacy will need to call our pharmacy to transfer the refills. It just takes a quick call to your home pharmacy, let them know, I have prescriptions at UW Hospital and clinics. Could you transfer them to your pharmacy? You can make this call as easy as the first day you get home. Finally, I want to mention travel. Let's say you are going on a fun vacation to Hawaii. Please bring a few extra days of your medications with you on your trip. With flight delays becoming more and more common, you never want to be without your medications away from home. Travel also includes clinic visits where you also want to bring along a few extra days of medications. Side effects are another reason people stop taking their medications. Please call your transplant coordinator if you have side effects to medications. Your coordinator is a fantastic resource and one that is available 24/7 to help you. The key point here is do not stop taking your medications unless told to do so. So in summary, medication adherence is key, and follow your discharge paperwork exactly as written. We are already done with Section 1. And now we can move on to Section 2, Tools and Resources. Turn the page. By the red phone on your sheet, there are some key phone numbers to keep on hand. This is a great sheet to keep handy posted on the fridge. I will point out the third bullet point titled Transplant Pharmacy B45. This phone number will connect you with the specialized pharmacist on our unit. The last bullet point, titled Transplant Clinic, is a helpful number you can use to confirm or change appointment times. Under Adherence Tools and Resources, the first bullet point is titled Medication List. Once you are home, it is very likely that over time your medication doses will change. It is very important that you keep your own medication list at home and update it regularly. Some people simply keep a list using pen and paper, and others choose to use their computers and keep an up-to-date document. Either way, it is key that you keep an up-to-date medication list, keep a copy with you, and bring the list to your medical appointments. Another important tool is a medication box. We will give you a medication box and it is absolutely essential for a successful transplant. The UW Health Mail Order Pharmacy is another resource to help you manage your medications. We can mail your medications right to your front door on a monthly basis. If you are interested in this service, please ask to speak with one of our pharmacy technicians. And finally, your local mom and pop pharmacy may have special services they offer. I know some locally owned pharmacies will fill medication boxes for patients every month, so feel free to call your pharmacy and ask. Under Medication Resources, I have listed Transplant B45 pharmacists. During your hospital stay, you can always speak with a pharmacist to answer any questions you may have. Just tell your nurse you would like to speak with the pharmacist. I also want to mention an important point about medication refill approval. If your medication is out of refills and you need a refill, simply call the transplant clinic or your pharmacy who can fax a refill request to your transplant doctor. Your primary doctor will not be able to approve refills for your transplant medications. Finally, if you are currently living in the Madison area, you could choose to refill your medications at one of our pharmacies here at UW Health. Call at least 3 days ahead to refill your prescription. Okay, we have finished section 2. In summary, keep this list of important phone numbers handy. Keep an up-to-date medication list and call for medication refills 1 week prior to your planned medication pickup date. Time for a quick review. Question 1. Tim Thompson noticed he is out of refills for Tacrolimus, one of his important transplant medications. Who should he contact to obtain refills? Is it A, his transplant coordinator, B, his local pharmacy, or C, his favorite dentist? Both A and B are correct. C is not correct. Even though Tim's dentist may be the nicest dentist, he cannot approve refills for transplant medications. We have finished with section 2. Now let's move on to our last section, medications and supplements. Turn the page. You can see by this slide that we are going to review 3 key points in this last section. 1. Anti-rejection medications, 2. Anti-infective medications, and 3. Supplements and other medications. To make things simple, I like to categorize medications into 2 groups. In group 1, there are medications to keep your new organ healthy. These are your anti-rejection medications, because they are keeping your organ from rejecting or failing. In group 2, you have your medications that keep you healthy by preventing you from getting sick. These are your anti-infective medications and supplements. Let me try to explain why all of these medications are absolutely critical for you to take by asking, have you ever had a cold before? I know I have. When you have a cold, there is a foreign virus in your body that is making you feel sick. About 4 to 5 days later, your cold goes away because your body actually kills the virus. Your body knows this virus is something foreign that should not be there, and the virus is destroyed. After a transplant, it is kind of the same idea. Your body thinks your new organ should not be there, and as a result, the first response is for your body to attack your new organ. To keep this from happening, we give you anti-rejection medications to lower your immune system. We can greatly lower the risk of your organ being attacked, but because your immune system is lower, we also need to provide you with medications to protect you from getting sick. These are the anti-infective medications and supplements. So the typical home routine has 3 anti-rejection medications, which are Tacrolimus, mycophenolate, and Prednisone. I like to call these medications the big 3 because these are the 3 medications that work together to keep your organ working well for you. The 3 typical anti-infective medications are an antibiotic, which prevents a type of pneumonia, an antifungal, which prevents a fungal infection, and an antiviral, which prevents a viral infection. These anti-infective medications, along with supplements, will prevent you from getting sick. The next question is, who should know about my medications? The answer is, all healthcare providers. Your dentist, your doctor, and especially your pharmacist should know. In fact, your pharmacist checks for drug interactions at every refill of your medication, and so this is a key person to provide an updated medication list to. Also, please tell your transplant coordinator if other doctors make medication changes. Turn the page. Now let's discuss your anti-rejection medications, the big three. Of note, the big three have three common side effects. First, they can increase blood pressure. Second, they can increase blood sugar. And third, they can increase cholesterol. The good news is that we give you medication to control your blood pressure, blood sugar, and cholesterol. The first medication in the big three is prednisone, which is a steroid medication. One common side effect of prednisone is hyperactivity, which some people describe as jitteriness, almost like they drank 5 to 6 cups of coffee all at once. Because of this, we try to not give prednisone close to bedtime so that you are not kept up at night. Another common side effect is stomach upset. Prednisone can be hard on the stomach, and because of this, it should be taken with food. A very rare side effect of prednisone is stomach bleeding, which is listed on your sheet as stomach ulcers. We will give you a medication to further reduce your risk of stomach bleeding. Finally, under special tips, we recommend that you have a yearly eye exam while on prednisone, as this medication can increase the risk of cataract development. The good news with prednisone is that we lower the dose the farther out you are from your transplant, so many of the side effects you may notice now will likely go away as we lower your dose. The next medication in the big three is Tacrolimus. The brand name for Tacrolimus is Prograf, and so this may be listed on your bottle. Some common side effects of Tacrolimus are tremors, kidney injury, hair loss, and diarrhea. Now with that said, just because I mentioned these side effects, it doesn't mean that you will have them. These are just some general side effects mentioned by some people that take the medication. Tacrolimus can be taken either with or without food, but the key is to take it the same way each time. Food does affect how well tacrolimus is absorbed. It does not matter what type of food you eat or how much you eat. However, you should avoid grapefruit and grapefruit juice as a transplant patient. Any other juice is fine. Under monitoring, I need to mention that tacrolimus is a medication that will need appointments for blood draws. These blood draws help us to know if your tacrolimus is at the right dose and if you have too much or too little in your body. Often, your blood is drawn more frequently right after having a transplant. Over time, you do not need to come in as often. What you need to know is that tacrolimus blood draws are usually scheduled on Mondays. You should not take your morning tacrolimus until after your blood is drawn for a tacrolimus trough level. You can take all other morning medications before your lab draw except tacrolimus, which will be taken right after your lab. Let me give you an example. Let's say that you usually take your tacrolimus at 8 a.m., but tomorrow you have a tacrolimus lab draw scheduled for 9 a.m. When you wake up tomorrow for your lab draw, you can take all of your other medications at 8 a.m. except for tacrolimus, which you would take after your lab draw at 9 a.m. Under special tips, I just want to mention that if you do notice a tremor or other side effects to tacrolimus, please contact your transplant coordinator. Turn the page. Mycophenolate is the last medication in the big three and is pretty well tolerated. The two brand names for mycophenolate are Myfortic and Cellcept. The most common side effect of mycophenolate is stomach upset, and this often goes away within the first few weeks of taking the medication. To further reduce stomach upset, mycophenolate may be taken with food. Your cell counts can also be reduced while on mycophenolate, but we watch for this at your clinic visits. Under special tips, it is important to never crush or break a Myfortic tablet because there is a special coating around the medication to reduce stomach upset. If you break this tablet, you will likely experience some stomach upset. Also, mycophenolate can cause great harm to an unborn baby, and women who are pregnant or planning on becoming pregnant should not handle this medication. We have gone over all the medications in the big three. We are now going to skip cyclosporin, sirolimus, and azathioprine on your sheet. These medications would only be taken if you were not taking a medication in the big three. Turn the page. In summary, you are taking 3 medications to prevent organ rejection. Prednisone should be taken with food, and do not cut or crush mycophenolate tablets. And now for a quick review. Jenny Jacobson just received a transplant and is trying to remember what products should always be avoided when taking her Tacrolimus. What products should we tell her to avoid when taking her Tacrolimus? Is it A, grapefruit juice, B, mycophenolate, C, prednisone, or D? The correct answer is A, grapefruit juice should be avoided when taking Tacrolimus. Jenny Jacobson just received a transplant and has a lab draw scheduled today for one of her anti-rejection medications. Jenny is now trying to remember what medication should not be taken until after her lab is drawn. What should we tell her the medication is? Is it A, prednisone, B, mycophenolate, C, the multivitamin, or D, tacrolimus? The correct answer is D. Tacrolimus should be held until after her lab is drawn. We just talked about the medications to protect your organ. Now let's switch gears and discuss medications to protect you by preventing infections. The first medications we will mention are immunizations. There are 2 key points I want to make about immunizations. First, you should not have any immunizations within the first 6 months of transplant. Second, if you are ever thinking of getting an immunization, you need to first call the transplant coordinator. The reason is there are certain immunizations that contain a live virus that can harm you. Rather than memorizing which vaccines are safe and which are not, just call your coordinator and ask. Turn the page. Under Why do I need anti-infective medications? I have listed some common signs of a fever, bladder infection, pneumonia, and wounds that do not heal. Because your immune system is suppressed, if you notice any of these signs, please call your transplant coordinator. I mentioned earlier that there are 3 medications commonly taken to prevent infection. The first medication is Bactrim, which is taken to prevent a type of pneumonia called PJP. The generic name for Bactrim is sulfamethoxazole trimethoprim, and your medication bottle will likely say sulfamethoxazole trimethoprim, not Bactrim. Under side effects, Bactrim can increase your skin's sensitivity to sunlight, and so sunscreen should always be used as a transplant patient. In addition, Bactrim can cause stomach upset and should be taken with food. I have a bottle of water on this slide because if you are not on a fluid-restricted diet, Bactrim should be taken with a full glass of water. Finally, if you ever notice a rash while on Bactrim, please see the doctor right away. Atovaquone is an alternative to Bactrim for patients who cannot take sulfa medications. This medication is a liquid and is taken once per day. It can cause nausea, vomiting, cough, or headache. If you notice a rash, please see your doctor right away. Turn the page. Next are antiviral medications. To prevent viral infections, either valganciclovir or acyclovir can be taken. You will be told to take one or the other, but not both. Which one you take is dependent on what viruses you and your donor have been exposed to. The brand of valganciclovir is Valcite, and the brand of acyclovir is Zovirax. The common side effect of these medications is a decreased white blood cell count, which we monitor for in clinic. You will also be taught how to identify if your blood cell counts are too low based on your lab results. Next are antifungal medications. To prevent a fungal infection, either itraconazole or clotrimazole can be taken. Again, you will be on one or the other, but not both. We often cause clotrimazole your suck tab because it is dissolved in the mouth. Do not eat or drink for 10 to 15 minutes after taking clotrimazole. Itraconazole, on the other hand, is a liquid and must be taken on an empty stomach. It is important that you tell your transplant doctor if you are started on any other medication while taking itraconazole because it interacts with a lot of medications. One of the best ways to prevent getting sick is keeping your hands clean, and we take this very seriously at the hospital. Before any employee enters your room, they use alcohol gel to clean their hands. We also provide you with hand wipes to clean your hands prior to each meal, so please use those. And when you go home, it's very important to continue good hand hygiene to prevent you from getting sick. So in summary, please call the transplant coordinator prior to receiving an immunization. Also, remember you are taking 3 medications to prevent a bacterial, viral, and fungal infection. Bactrim should be taken with food, and do not eat or drink for 10 to 15 minutes after taking clotrimazole. And now time for a quick review. Peggy Potter is taking Bactrim as prescribed. What should she always remember to do as a transplant patient, and especially while on Bactrim? Is it A, wear sunscreen, B, avoid pink t-shirts, C, avoid drinking water, or D, take on an empty stomach? The correct answer is A, wear sunscreen. Peggy certainly can wear pink t-shirts if she wants. And Bactrim should actually be taken with a full glass of water, and it should be taken with food. Turn the page. Next up is supplements and other medications. Under supplements and other medications, I've listed over-the-counter supplements that are often taken after transplant. I want to stress again that you will need to buy these at a pharmacy. The first 2 medications listed are calcium and vitamin D. Both of these are taken for bone health, as some of your transplant medications can reduce bone density over time. The third medication listed is magnesium, which maintains correct heart rate. Many transplant recipients have low magnesium. Then we have a multivitamin, which is taken for general health. The next 3 medications are proton pump inhibitors and include pantoprazole, omeprazole, and lansoprazole. Remember when I said that prednisone can slightly increase the risk for stomach bleeding? These medications dramatically reduce the risk by lowering stomach acid. Ranitidine or famotidine may be used in place of omeprazole or pantoprazole to reduce stomach acid and the risk of a stomach ulcer. Low-dose aspirin is used to prevent heart attack and stroke. Over-the-counter aspirin comes in 2 different strengths, 325 milligrams and 81 milligrams. Unless the high dose is indicated on your discharge sheet, you should be taking the low-dose 81 milligram aspirin. Cholesterol-lowering medications such as atorvastatin, pravastatin, or other statin medications are prescribed in heart transplant recipients to prevent chronic rejection. For other transplant recipients, these medications may be prescribed to lower cholesterol and protect the heart. Turn the page. Under other possible medications or changes, I wanted to mention that while at home, we would like you to take your blood pressure at least once a day and write the reading down to bring it to clinic. Your blood pressure goal after transplant will be determined by your transplant doctor, and it is essential that we know what your blood pressure readings have been at home. Since transplant medications, especially prednisone, can raise your blood sugar, you may be started on a medication such as insulin to control blood sugar. You also may be started on antibiotics before procedures. Everyone at some point will get a cold. It is caused by a virus. Transplant patients have to be careful about what over-the-counter products they use because active ingredients may contain medications not recommended after transplant. You may take Coricidin HBP for cold symptoms. Do not take pseudoephedrine, also known as Sudafed, or phenylephrine. Turn the page. There are certain medications that you need to avoid after a transplant. I mentioned before that unless otherwise indicated, you should be taking a low-dose 81 milligram aspirin and not the 325 milligram aspirin. A group of medications that need to be avoided are NSAIDs, such as over-the-counter ibuprofen, also known as Advil, and over-the-counter naproxen, which is also known as Aleve. These can cause stomach bleeding and are very hard on your kidneys and cannot be taken after a transplant. If you do have a headache and would like to take a medication for pain, you can use acetaminophen, also known as Tylenol. There's a daily limit to how much Tylenol you can take, and in this limit is 4,000 milligrams per day. If you have liver disease, that limit is less at 2,000 milligrams per day. Again, as a transplant patient, you should not eat grapefruit or grapefruit juice. As you know, taking your medications as written on your discharge form is extremely important. Still, if you do miss a dose of medication, I want to make sure that you have a plan in place. If you do miss a dose of your medication, please call your transplant coordinator. They will instruct you on what to do. On your sheet, I have listed the halfway rule, which states that if you are less than halfway to your next dose of a medication you have missed, it's usually safe to take that medication when you remember. Here's an example. Let's say you are taking one tablet at 8 a.m. and 8 p.m. You accidentally forget to take your 8 a.m. morning medication and realize you forgot the medication at 11 a.m. Since 11 a.m. is before the halfway point between 8 a.m. and 8 p.m., it should be safe to take after first calling your coordinator. Storing your medications away from humidity is important to keep your medications working well for you. Avoid storing your medications in the car, bathroom, or kitchen. Turn the page. Finally, I want to mention skin cancer risk. Being on anti-rejection medications can increase your risk of developing skin cancer, no matter your ethnicity. And this risk can be greatly lowered by applying sunscreen, SPF 30 or greater, anytime you are outside. Believe it or not, this also includes the winter time because the sun is still out. So please, always wear sunscreen when outside. In summary, buy supplements indicated on your discharge sheet over the counter at your local pharmacy. Monitor and record blood pressure readings at home, and wear sunscreen SPF 30 or greater while outside. The rest of this handout is for your reference to help manage side effects. We are done with the official course, but I want to tell you a little bit about medication boxes. Medication boxes help you to organize your medications and come in many different sizes and styles. Some medication boxes are very large and sturdy but cannot be taken with you easily. Other medication boxes are smaller and can pop out a day's worth of medications to take when you go out and about. They are organized Sunday through Saturday across the top, and they have 4 dosing periods: 8 a.m., 12 noon, 4 p.m., and 8 p.m. And these correspond to times morning, noon, evening, and bedtime. Here I have an example of a discharge sheet. This is similar to what your discharge sheet will look like. I have enlarged it here so you can see the 4 dosing times: AM, noon, PM, and bedtime. All right, let's fill the box. As you can see, the patient is taking 6 yellow tablets in the morning. And as you can see, she has placed her 6 yellow tablets in the appropriate slot. She is also taking 3 green capsules in the morning and 3 green capsules at dinner. You can see that she has placed her green capsules correctly in the box. Finally, she has taken 2 blue tablets in the morning and 2 blue tablets at dinner. She has placed her blue tablets correctly in the box as well. You can fill 1, even 2 whole weeks at a time. This will save you a lot of time and help keep you organized with your transplant medications. And this concludes the transplant medication video. I would like to thank you for watching. I hope that you found it very helpful. A member of the pharmacy team will be happy to answer any questions you may have, and on behalf of the transplant pharmacy team at UW Health, have a wonderful day.